It helps us do right versus be right. It really helps us designate what the problem is, but more importantly, design a solution and a way of being able to measure the implementation of that solution to make sure that what we're doing is actually benefiting the public.
We've made tremendous gains as a society on a whole host of issues, everything from the environment to the economy to the performance of different individual groups in our society. But incremental gains, how we go from where we are now to something even better, is going to require relying on data and evidence to figure out what works and what doesn't.
Data are central to public policy outcomes and implementation. They are really effectively the only way we have to understand the difference between our policy intent, whether it's environmental or social or economic, the actual way in which that intent is going to be realized by public policy, and then measure the actual outcome and assess whether or not we've done the right thing or whether or not our policy implementation need to be modified. Data are absolutely central to the exercise of any public service outcome.
For example, the settlement needs of an economic immigrant are very different from a racialized woman who comes to Canada as a refugee. And so using that data to understand what their needs are and what their later outcomes are allows us to target our programming and to understand how that individual likes to access services, whether it's virtually, whether it's in person in the classroom, and then also look at where they're facing barriers.
Well, I think data is key to helping us ensure that our policy intent actually matches our policy outcomes. We need to be able to understand issues as they're emerging, understand population, the diversity of our population and needs, and then use data and evidence to really understand what is the right mix of policies, programs, and services. We need to use data to understand that they're cost effective so that we can get the right dose as efficiently as possible and be able to deliver outcomes that actually move the needle at scale.